In the immediate term after surgery, there's really only one thing that can happen, and that's bleeding. So that's why we see you back the next day. One of the great things about this place is that we own the operating rooms. So if you come back the next morning and I see that there is blood around the pocket or around the implant, we just drop back into the operating room, take care of the problem, and you're ready to go in 20 minutes. If you treat it that way, it's not a big deal. But if you let it go, if you let it fester for weeks at a time, yeah, it can be a problem. So that's why we see you back on the first day. Then we want to make sure that the wound, the little cut that we make, heals well. Most of our stitches are on the inside and you don't see them, but we want to make sure that everything is healing well. So we see you back at a week. We want to make sure that the implant, which tends to come a little high for a while, is starting to soften, is starting to come down. And that's why I like to see you back at a month. If at a month things are still high, there's a medicine I can give you to help sort of hasten the process. I give it maybe 1 out of 10 times. And then we see you back at 3 months and see how we did. But at 3 months, the complications or problems fall into 2 different types, either capsular contracture or implant malposition. So let's talk about capsular contracture for a second. What is it? Well, anytime you put an implant, any implant, in the body, anywhere in the body walls that implant off with scar tissue. You can put a knee implant in, or a wrist implant, or a pacemaker, or anything like that, and the body's going to wall it off with scar tissue. And in this case, it's called the capsule, what you put the breast implant in. The scar that forms is called a capsule. Now, normally the capsule is just a flimsy, thin, cellophane-like layer of tissue. What we think now, as surgeons, is that if a bacteria or something like that gets on the implant or in the capsule, it will provoke the little cells that live in that capsule to contract down. And what that will do is make a sphere and get hard, right? And so we do our utmost to prevent bacteria from getting on breast implants. We give antibiotics, we cover nipples, we make incisions under the breast most of the time. We use this thing called a Keller funnel, which is a great way of just not even touching the implant. We inject, we even go so far as to when we open the implant packet, we're concerned that there may be some disturbance in the atmosphere, and so we squirt antibiotic into the closed packet to sort of make a positive pressure so that the implant doesn't see any things that might be floating in the air. All these things keep bacteria from laying out on the implant, but you can get bacteria on the implant just through your own blood system. And so things can happen afterwards, and we've got to modify them. Capsular contracture leads to the hardening of the breast, but it's preceded by a discomfort, a general pain in the breast. And you'll wake up maybe one morning and think, gosh, did I pull a muscle or something? And what I want you to do at that point is think, no, I need to call Sigal. Because if I get you then, I can usually treat this with pills and make it go away. There are many treatments for capsular contracture, and we can always fix it, and always make it better. But it depends really on what we're looking at as to what treatment we'll bring to bear. Implant malposition is a different problem, and it's also very rare. But it's when the implant sort of doesn't lay out right underneath the breast tissue. You'd like the implant and the breast tissue to read as one unit. But if the implant drops out, and that's the most common cause, or drops out to the armpit, that's the next most common, a lot of times we have to reposition the implant. And that's not very common in our practice either. Again, we warranty our results, and if we do have to do it, it's not going to cost anything. But it can happen. And the fix for that is, again, depending on the implant and its malposition. Go ahead and hit the like button if you enjoyed this video, and feel free to share with a friend. You can stay up to date with the latest in cosmetic surgery by subscribing to the Austin-Weston YouTube channel. And for more information on the Austin-Weston Center, visit our website at austin-weston.com or click the link in the description below.